Thank you all for being here again for a little update from the City of Charleston. I'm so pleased to have with us today also the Mayor of Mount Pleasant, Will Haney, who can also give an update for his side of the river. Everybody knows the numbers, but I do start with a recount of them. Over 2 3/4 million cases worldwide, with approaching 200,000 deaths. 200,000. 870,000 of those cases are now in the United States. Every 2 or 3 days it bumps up another percent, now at 31.8, almost 32% of the world's total cases are in the United States of America, with over the threshold today of over 50,000 deaths in the United States of America. South Carolina will report today numbers going over 5,000 for the first time, and over 150 deaths here in the state of South Carolina. Charleston County, only 4 new cases to 416, with 5 deaths reported thus far. So close contact businesses will remain closed, not just in the city of Charleston, but statewide. Stay-at-home orders basically are still in effect. What has changed is that there are more open businesses, more businesses that are now considered essential or not considered non-essential, depending on which way you look at it. But there are more businesses that are authorized to open, but still the recommendation for folks during this time is to stay at home and only go out for essential services and products that you need. So those businesses that do open, as we've been doing for some few weeks now with the essential businesses, but a bit broader list now, the city of Charleston Wednesday evening passed the state's most restrictive ordinance on decreasing the risk of exposure to COVID-19 in retail businesses. And really what we're doing is following the best practices put forward by our healthcare professionals, DHEC, and the Centers for Disease Control. And we've compiled them into our ordinance so that our businesses that operate in Charleston do follow best practices to keep not only themselves and their employees safe, but also our customers and citizens who come out. So speaking of our healthcare professionals, we continue to work particularly closely with the Medical University of South Carolina, but also with DHEC, on increasing the availability of testing, not just the testing where you find out whether you got the virus or not if you're showing symptoms, but we'll be rolling out with the Medical University next week, starting testing to see whether you have antibodies, whether you've built up some immunity to the coronavirus. Building a regiment of folks who can do contact tracing, so that in the future, when folks are identified, in addition to the work that DHEC's been doing all along, that other people will be able to get involved and help do contact tracing. Because as you open back up the economy and try to get to a new normal, we'll still be in a space until there's a definitive treatment or a vaccine that anyone who tests positive will need to track down who they've been in contact with and try to keep the spread of the virus down. So in the meantime, we continue by staying at home and being smart to try to reduce the number of cases and reduce the rate of increase in the state of South Carolina and in the Charleston region. And so if you look at the state figures county by county, some counties are doing a little better than others. Charleston County over the last 2 weeks, I think, is a result of all our citizens collaborating and responding to this message of staying safe. We have brought that rate of increase down in Charleston County, and that's good news. but now is not the time to let up just yet. And admittedly, yes, we're working with the business community and our healthcare professionals to plan our strategic reopening and getting back in business. My goodness, that's important for our economy and for our citizens, but we have to do it smartly, and we're working on that. Without further ado, I'd like to call on my colleague, my fellow mayor, Will Haney from the city, the town of Mount Pleasant. Will.
Thank you very much. I want to say to the listening and watching public, we are wearing our mask, and we highly advise you to do the same thing. And we're going to fight this virus. We're going to win this virus. We're going to win against this virus. We're going to get life back to normal as soon as we can. Thank you, Mayor Tecklenburg, for having me here today. It works well for everybody to do this in a consolidated manner. I want everybody to know that I have never seen more collaboration and more discussion and more teamwork than I have with this. We've done it with hurricanes. We did it with Bridge Mageddon back in 2018. And just the phone calls, the coordination on everything, from reopening businesses to when to do stay-at-home orders, to looking at a phase-in of parks and green space, to looking at the numbers. And so all the things that Mayor Tecklenburg was just talking about the serology testing that MUSC will be doing that will help us get business back to normal. We're all in this together. We're working on this together. We all have the same information at the same time, which is good to have. One of the things we want to stress as businesses sort of phase in opening is that we want people to know that our cities are a safe place to come, a safe place to do business when the time is right. So the governor's order this week opened up some businesses that previously had not been open. I know that in the town of Mount Pleasant, there was not a rush to open because business owners want to be very careful. Monday night, when our council meets at an emergency meeting, we will be looking at measures like y'all passed, because we don't want to be sending people from one of our municipalities to the other and vice versa. We want them to be equally safe so that you know you can do business in the town of Mount Pleasant or in the city of Charleston. So we'll be working on that. I want to thank the citizens of Mount Pleasant for what you have endured this far. We never thought we would see anything like this. We never thought we would see jobs lost and businesses closed. And as an Air Force officer at the local Air Force base told me this week, there's a saying in the Air Force that just because the parachute has reduced your rate of descent doesn't mean it's time to take it off. So we're not taking the parachute off now. It has slowed our rate of descent. We are thinking that we have reached a plateau in Mount Pleasant. Our figure today was about 106 cases, but it takes a few days to see if that's a trend. That could be the timing of the results coming back. That could be simply a matter of how many people were tested. So just because the numbers are looking better doesn't mean that a scientifically approved trend has happened. But so far, it looks like we have a plateau. As for the condition of your town, there's been no reduction in services. All staff are working. Police, fire, garbage, everything is on schedule and at full force. Those who have jobs where they can't work from home, like receptionists and clerks and people like that, we have everybody employed. Nobody has been furloughed, and they are out doing things like assessing sidewalk safety. They have found several hundred places where there's a trip risk and these type things. So we are bettering our town in every way. We began our preparation in February, so I'm real proud of what our staff has done under the capable direction of our administrator, Eric DeMora. We have a freeze on employment, and we've canceled the pay raise that was scheduled to go into effect when we start our fiscal year. We project that we will end this fiscal year on June 30th at a break even. We are not projecting a loss at this time. We're working on the forecast for what this will do for our budget for the town's income in 2021, and we have not had to dip into our reserve fund yet, which is significant. We have a healthy reserve fund. We have not had to dip into it yet. The phase-in of the essentials market, which is held at the location of our farmers market, has gone well the past 2 Tuesdays. And then on recommendation of Councilman Santos's Recreation Committee, We have approved and are putting in effect a phased-in approach for 3 areas for healthy recreation and exercise beginning at 10 a.m. Saturday, and those are at Park West, the Cygnus Field at Bell Hall, which is behind the Jones Center, and the Woods Flowers Soccer Field at Patriots Point. So you got something on the north end, something on the south end, and something on the middle. The restrictions and the safety precautions are huge. There's this graphic that's been put out. You can see it on our Facebook page. It tells you what the restrictions are, and based on how well everybody cooperated and with our staff's supervision at the Essentials Market, we feel like this will be successful. But if we learn a lesson that the beaches learned once they open the beaches, if there's disregard for safety, just as we are beginning to win this fight, these things can be rolled back, but we don't want to have to do that. And finally, council will be meeting on Monday night. Our council has been very good, very supportive, and very aggressive in this fight. And what we will do at that meeting is get an update on all our town operations. We'll get a report of feedback from staff on how this phase 1 of our park openings has gone. We're going to look at what the plan will be. We won't be presenting a budget for 2021, but we're going to talk about how many budget committee meetings, finance committee meetings, what data needs to be gathered so that we have a good view of our budget for 2021. And then we have a plan for the phased reopening of all of Mount Pleasant, businesses, our town hall, and everything. But let me say again, we're not taking the parachute off yet just because the rate of descent has decreased. So hang in there, Mount Pleasant. I'm real proud of you. Thank you, Charleston. I can't imagine a better partner to work with than Mayor Tecklenburg and everybody at the City of Charleston. And we're closer to the end than we are to the beginning, but please, we are not at the end yet. Thank you.
So while you're at the podium, does anybody have a question for Mayor Haney?
Thank you.
All right, thank you, Mayor Haney. Any questions for me or the City of Charleston?
Mayor Tecklenburg, could you talk a little bit more about the antibody test that you're saying might be available next week, how that would work, and how people could get their hands on that?
Right. Well, I should have prefaced that to say we're starting with our own employees, and the Medical University has already begun with their own employees, not somewhat of a test to get these tests going. The other local cities, Mount Pleasant, the County of Charleston, and City of North Charleston also agreed to participate in kind of initial tests of rolling this out. But once Medical University has the protocol down, it will be available, I understand, on a wider basis.
And then also last time we met, you talked about city markets and you were working on a plan to figure out how to get those back open and get vendors back in there. Are there any updates on the timeline for that?
No update on that yet, actually. We're still working on that. And that's just the one facility that the city owns that we call the city market. All right.
I know Mayor Haney said they're thankful that they seem to be doing good budget-wise. Is Charleston in same group of you guys, hopefully kind of riding out that wave? Or?
Yeah, I might be calling Mayor Haney for a loan. You know, we had a meeting earlier this week with council and got an update from our chief financial officer, which indicated, now we operate on a calendar year rather than a fiscal year that ends June 30th. So we're expanding our projection out all the way to December 31 and making assumptions about the hospitality business through the end of the year. And I do know that we're a little more reliant on hospitality and accommodations taxes than Mount Pleasant is. But we're projecting a $41 million shortfall of revenue. We'll also have, you know, some lessening of expenses, and we have, in addition to a reserve fund, we have some fund balances that we'll be able to use. We also, at this point already, have a hiring freeze in place, and many of the jobs that we had approved in this year's budget for new positions are currently on hold. So we're further evaluating other expense items that we can trim back over the year. But our revenue shortfall will be significant. We do hope the federal government will support small local government in their next rendition of the CARES Act. You may or may not know the federal government provided some billions of dollars for governments, but only those with a population more than 500,000. So in the state of South Carolina, Greenville County was the only local jurisdiction that qualified thus far for some direct federal support, other than like specialty things like the airport. The Charleston Airport actually received $22 million from the federal government to support their operation and their losses. So we're hopeful to get some support from the federal government. We'll see how all that shakes out.
I wanted to ask about our state neighbor, Georgia, reopening today, and if you had any reactions about that, either of you?
I think they're way ahead of the curve, particularly for contact businesses. And, you know, they didn't wait the prescribed recommendation from the federal government, from CDC and President Trump, that there should be 2 weeks of declining values before opening businesses like that. So I would have urged him to hold off on that, but they're proceeding forward. Well, thank y'all again for being with us today and keeping up with us as you all have done, and sharing this with the public. Stay home, stay smart, stay distance. That's, like I said, I'm sounding like a broken record. For those of you who aren't old enough to have vinyl, that's when the record gets a deep scratch in it, and the same thing repeats over and over again, right? That's where that expression comes from. Stay home, stay distance, stay smart. Thank you very much.